There's been a couple of questions here about relationships with other professions, and I've lost one of the questions, but it's basically about a lady says, I'm not going to read her name because it's a distinctive name, the role of the GCC is to protect patients, and I'm sure most of the delegates here can give anecdotal evidence that the patient's interest is not being served by the other professionals, GPs and physios, telling our patients that to stop having treatment with us, which may be proceeding very successfully. Because we don't know they're saying it because they say we don't know what we're doing, we're just after the money, or that we're quacks, no scientific background. Surely the GCC in its meetings with other regulators should be educating them that the patient's best interest is continuing with a route that is getting results with educated professionals. And that's one of many questions about how do you influence the other medical bodies through their regulators to stop them being dismissive of chiropractic.
Look, I think it's a really good point and an important question, and I hear it. I've heard it several times over the last few weeks and months as we've been having discussions about the new code. I think it depends on the tone and the content of what's being said and written and so on. But on the face of it, it's unprofessional. And it's something that should be brought to the attention of the person who's saying it or doing it, and if necessary, brought to the attention of the regulatory body of the profession concerned. I think it is totally unprofessional to be saying that.
And it's certainly part of our code, and probably our equivalent of the code, that you must be respectful towards other professions.
Indeed. And what I've observed over the last few years as I've been going out to some of the education institutions, is the way in which graduates are hold themselves. The maturity, the self-confidence that they have, and it's absolutely vital that they're joining a profession, having worked often alongside other disciplines in their undergraduate study. There is more and more of that going on. So I think in terms of the future, it's a bit more promising. But there are antediluvian attitudes that are held by some professions, and that is totally unprofessional. As regards to what I can do about it, this is, it is fairly limited. But what I can say is that I am very lucky to have been elected as the chair of the group of Chief Executives of regulatory bodies, and that's a forum that meets on a monthly basis. I think registrants and the public expect us to talk to each other, and we do. And I chair that group, and that's a privileged position to have. And it's good for the General Chiropractic Council that we've been entrusted through me to carry out that role. And it's certainly a discussion that we have in terms of attitudes and so on. If it's a doctor, are the GMC going to listen to me? Well, they'll listen with interest, but there's potential in communication to their professionals, if you like, as to those expectations.